Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Stuttering Severity Instrument, 4th edition, assesses the frequency, duration, and physical concomitants of stuttering behaviors. It quantifies the severity of stuttering in individuals across various age groups. The instrument measures speech disfluencies, including repetitions, prolongations, and blocks. Its main purpose is to provide objective data for diagnosing stuttering severity and monitoring changes over time. The tool assists speech-language pathologists in developing and evaluating treatment plans for individuals with fluency disorders. The Stuttering Severity Instrument, 4th edition, is indicated for individuals who exhibit stuttering behaviors across a wide age range, including children, adolescents, and adults. It is most useful in clinical settings requiring objective measurement of stuttering severity to guide diagnosis and treatment planning. The instrument assesses frequency, duration, physical concomitants, and naturalness of speech, providing quantifiable data to track changes over time. It is particularly valuable for patients presenting with developmental stuttering or acquired stuttering due to neurological etiologies. The tool aids speech-language pathologists in establishing baseline severity and monitoring therapeutic outcomes in both individual and group therapy contexts. The Stuttering Severity Instrument, 4th edition, consists of 24 items that assess 3 core areas: frequency of stuttering, duration of stuttering events, and physical concomitants. The clinician begins by recording a speech sample during reading and spontaneous conversation tasks, ensuring the sample contains approximately 300 syllables. Frequency is calculated by identifying stuttered syllables within the sample and expressing this as a percentage of total syllables spoken. Duration is measured by timing the 3 longest stuttering events in seconds and calculating the average. Physical concomitants are rated based on observable secondary behaviors, such as facial movements or body tension, using a 4-point Likert scale from 0 for no evidence to 3 for severe behaviors. Scoring involves converting individual raw scores from each component into standardized severity scores, which are then combined to generate a total severity score ranging from 0 to 100. Severity is interpreted using normative reference ranges where scores from 0 to 10 indicate very mild stuttering, 11 to 20 indicate mild stuttering, 21 to 35 represent moderate stuttering, 36 to 50 fall within severe stuttering, and anything above 50 signifies very severe stuttering. This structured approach allows for objective assessment and consistent monitoring of stuttering severity over time. The Stuttering Severity Instrument version 4 demonstrates variable sensitivity and specificity depending on the population and criteria used for diagnosis. Sensitivity refers to the instrument's ability to correctly identify individuals who stutter, meaning the proportion of true positives detected. Specificity describes the ability to correctly identify individuals who do not stutter, representing the true negatives. Reported sensitivity values for the Stuttering Severity Instrument range from approximately 0.75 to 0.85, indicating it accurately detects 75 to 85% of cases with stuttering. Specificity values have been observed between 0.80 and 0.90, signifying that it correctly excludes stuttering in 80 to 90% of individuals without the disorder. For example, in a clinical setting, a sensitivity of 0.8 means that out of 100 individuals who stutter, 80 will be correctly identified, while 20 may be missed. A specificity of 0.85 implies that out of 100 individuals without stuttering, 85 will be correctly classified, while 15 may be incorrectly identified as stuttering. These metrics affirm the instrument's usefulness for clinical assessment, but highlight the need for complementary evaluation methods. The Stuttering Severity instrument, 4th edition, originally developed by Riley in 1972, has undergone extensive validation to establish its reliability and clinical utility. This instrument quantifies stuttering severity through measures of frequency, duration, and physical concomitants associated with stuttering events. Subsequent research by Yarous and Quesal in the early 2000s provided robust evidence for the instrument's construct validity and internal consistency, noting strong correlations between the instrument's scores and other established stuttering assessments. Test-retest reliability has been demonstrated with coefficients typically exceeding 0.9, indicating stable measurement across administrations. Inter-rater reliability studies conducted by Fleischmann and colleagues in 2017 reported agreement rates above 85%, affirming consistent scoring among trained clinicians. Furthermore, the instrument's sensitivity to changes in stuttering severity post-treatment has been documented in longitudinal studies, reinforcing its applicability in both clinical and research settings. Collectively, these validation efforts substantiate the scientific rigor underpinning the stuttering severity instrument as a standard measure in stuttering evaluation. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.